welcome Amy Berger.
Thank you. All right, who's ready to learn about thyroid? Can you hear me? We had some issues with the mic earlier. Okay, all right. Let's talk about thyroid. Okay, I ask only one thing of you, and that is that you listen with an open mind. Because what I'm going to say is very unconventional and unorthodox. But if there was ever a perfect audience to talk about something unconventional and unorthodox, it's a bunch of people who eat low-carb, keto, and carnivore diets. So, all right, why do we need a talk about thyroid at a low-carb, keto-type event? Why do we even need to talk about thyroid? Well, and before I forget, if you do not have a thyroid problem or you don't suspect you do, don't tune this out, because I will put money, I will guarantee 100% you know someone for whom this applies. Most likely a woman rather than a man, because I'm talking about hypothyroidism more so than hyper. And hypothyroidism affects women to men at a ratio of 9:1. So it's much, much, much more common in women, although men do get it. So if it doesn't apply to you, it might apply to your wife, your mother, your sister, your daughter, your friend, or somebody you coach, a patient, whoever. All right. What about when you're doing everything right? You're following a low-carb keto diet, you're exercising, your health apparently is good. Your labs look great, A1C, glucose, insulin, triglycerides. You have the blood work of someone who is really healthy. And of course, now we know that may not define health, right, from the previous talk, but metabolically, you look good. You are sticking to your low-carb or keto diet. But maybe your cholesterol is a little high, so they put you on a statin. Maybe you're taking an antidepressant, maybe more than one antidepressant, because the first one didn't work well enough. And so you're metabolically healthy, but what if stubborn weight won't budge? You're doing all the right things, and you cannot lose weight no matter what you do. You probably feel frustrated, demoralized, disappointed, resigned. Well, I guess I'm never going to lose weight because not even keto works. So what do thyroid hormones have to do with fat loss anyway? Well, we've probably all heard, or maybe you haven't, maybe this is the first time, your thyroid hormones are the master regulator of your metabolic rate. They set the rate at which your body burns through energy. If you have thyroid problems, it will be very, very difficult to lose weight, even on a ketogenic diet, even with exercise. It is not uncommon to have hypothyroidism and go undiagnosed for years, sometimes decades. Or maybe you are diagnosed, but it's not treated properly, so you still have all the same signs and symptoms you've always had. Here's one. I won't ask for a show of hands, but I hope, but I also don't hope, that this resonates with somebody out there. Your doctor may have even accused you of lying about your diet and exercise. Well, there's no way you eat keto and exercise or you wouldn't still be fat. You must be lying to me. We call this medical gaslighting. It's a real thing, and it's a terrible shame. You cannot out-keto a major hormone imbalance. Ketogenic diets do not always fix this, although sometimes they can help. And Bronson's mom mentioned yesterday she's been able to reduce her thyroid medicine. Yeah, keto sometimes helps, sometimes it doesn't. We'll talk about that later. How do you know, or what should you suspect might tip you off to a thyroid problem? And again, I'm talking about low thyroid, not high. If you have hyperthyroidism, overactive thyroid, you are losing weight without even trying. So you don't come to a keto nutritionist for help with fat loss because that's not your problem. So big, now these are only the most common classic signs and symptoms. There are so many that are not on this list because the thyroid, there is not one single organ, gland, or tissue in your entire body that is not affected by thyroid hormones. So, but these are the big classic ones: weight gain, difficulty losing weight, even on a keto diet, depression, apathy, constipation, hair loss, feeling cold all the time, brain fog, low libido. elevated cholesterol. Can't tell you how many clients I've had who are on a statin drug and they're on thyroid medicine, and I can tell that the thyroid isn't addressed properly or they wouldn't need the statin, but getting ahead of myself, oh my God. Very passionate about this, I'm sorry. What are the thyroid hormones anyway? We'll start with something called TRH, thyrotropin releasing hormone. It is produced in the hypothalamus, which is an area of your brain, and it signals the pituitary gland, which is also in your brain, to make a hormone called TSH. TSH is thyroid stimulating hormone. When you go to the doctor and you ask for a thyroid test, or the doctor says, I tested your thyroid, 99.9 times out of 100, they are talking about TSH. They tested your TSH and your TSH only. And that's a big problem, and we'll get to why in a bit. But so TSH does exactly what it says, thyroid stimulating hormone. TSH tells the thyroid, knock, knock, hey, thyroid gland, go ahead and make some hormone. It stimulates the thyroid to produce its hormone. Now, the thing to know, this gold standard test of TSH that they measure is not even a thyroid, it's not made by the thyroid gland. It's made by your pituitary gland, right? So that's why I call it thyroid-related hormones rather than just thyroid hormones. Now we're in the thyroid gland. We have a hormone called T4, also called thyroxine. It is considered an inactive form of thyroid hormone. It is a precursor to T3, which is the actual thyroid hormone that does what we want it to do, like supporting a good metabolic rate, giving us energy, helping us have healthy hair, helping us feel good about life and have a good sex drive, and all those good things we associate with thyroid hormone. So the thyroid gland produces mostly T4. It produces also a little bit of T3, which is the active, potent form of the hormone. T4 has to be converted into T3. And most of that happens elsewhere in the body, but like I said, your thyroid gland does produce a little bit of T3, and some of the conversion of T4 to T3 happens inside the thyroid gland. So this is relevant for anyone, and I know there's at least one of you here who, if you've had your thyroid gland removed or irradiated, you are no longer producing whatever small amount of T3 your thyroid gland would make, nor is the thyroid gland there to do that little bit of conversion. So if you still feel like garbage, you will understand why by the end of this talk. If you're on thyroid medicine, but you've had your thyroid gland removed. Okay. It is absolutely critical to test total T3 and free T3 if you suspect you have a thyroid problem, or you suspect a client or patient has a thyroid problem, but the TSH is normal. I see this probably at least 3 times a week in people who write to me for help. My TSH is normal, or here's my thyroid labs, but the T3 is either in the toilet or it's on the low side of normal. We'll talk about problems with normal lab ranges in a minute, but hormones T4 and T3 are measured as total T4 and total T3, or free T4 and free T3. Hormones do not circulate in your blood freely all the time. They're bound to a binding protein. Think of it like an escort that carries it safely to where it needs to go, so that these hormones don't latch on willy-nilly anywhere and have effects we don't want them to have. So we need the T3 to be free, meaning unbound. If it's bound to the protein, it can't get into the cell, it can't do what it needs to do. We need this T3 to be free to get into the cell. Even measuring these levels in the blood is only second best, because thyroid hormone doesn't do any good floating in your bloodstream. It has to get inside your cells. So even this is a second runner-up. We don't really have a good way to measure how much is getting in the cell, so the next best thing is to measure what's in the blood. Okay, reverse T3. Most doctors refuse to order this because they think it's quackery. They also think ketogenic diets are a little quackery. So reverse T3, think of it like an imposter T3. It looks like T3, and it basically either fits into the receptor for T3 on the cell, or it blocks the real T3 from getting through. So it kind of fits there, but it doesn't do the job. Not only doesn't it do the job, but it blocks the real one you want from getting in. So it's not often measured, but it's really important to do. And I consider it a smoking gun when all other levels are normal, because just like we look at the triglyceride and HDL ratio, and we look at different ratios of things in the body, sometimes it's not always about the absolute amount of this thing in your blood, but its relationship to something else. That's exactly how reverse T3 and free T3 are. Even if these two things are within their normal ranges, if the reverse T3 is kind of on the higher side and the free T3 is kind of on the lower side, you've got this skewed ratio where all of that reverse T3, again, is blocking the real T3 from getting inside the cell. So it doesn't matter how much of it is in your bloodstream, because it's not getting in, right? So all of these are kind of, anyway. Antibodies. Anybody with Hashimoto's disease or Graves' disease, this is how they look at that, thyroid-related antibodies. Now, so a comprehensive, when you ask for a thyroid test, it is not enough to just get TSH. You have to insist on the comprehensive panel. But I want to emphasize, if you feel fine and you don't have any signs or symptoms of hypothyroidism, then it doesn't matter. Then you don't need a thyroid test. But if you have lots of signs and symptoms, and you've been told for years and years, your thyroid's normal, it's not your thyroid, I'm sorry, run along, honey, you just need to eat less and exercise more, you need the comprehensive panel. You can get it done on your own. You don't need a doctor, except in New York, New Jersey, and Rhode Island. It is not permitted. But there are ways around it. There are ways around it. Well, we'll talk later, like you can, but any other state in the US, you can get these done on your own. It's not that expensive, and even if it was, it's worth every penny if you get answers to why you feel so terrible and why you can't lose weight no matter how hard you work on a keto diet. Okay, I will show you an example in real life. This is a real life example of somebody I worked with as to why the TSH is not always enough. This is a person who was following a low-carb diet, exercising regularly, and this was before she was on thyroid medicine. Person appears to be in excellent metabolic health, right? A1C is 5.0, triglycerides are in the 30s, HDL is 100, but her total cholesterol is 275. That's kind of high. I don't care about it from a cardiovascular standpoint. To me, combined with the symptoms you're about to see, this is a sign that she might have low thyroid. First of all, her TSH was normal. Normal TSH. Her total T4 is low and the free T3 is low. So right here in living color is an example of someone where the TSH fails. The TSH, if the doctor had only tested TSH, we have no, because it's normal, we have no explanation for why she feels so crappy. For why she has gained weight out of nowhere, weight gain with no change to her habitual ketogenic diet and exercise. She's got the high cholesterol, severe constipation, losing hair like crazy, severe depression. TSH is normal. Don't tell me it's not the thyroid. Now, this person goes to a doctor who knows what she's doing. She gets put on a combination of T4 and T3 medication. Here's what happens. The TSH plummets into the basement. In fact, it's called suppressed. It's below the range. It's almost unmeasurable. It is so low, it's almost unmeasurable. However, the T4 is now normal and the free T3 is normal. The actual thyroid hormones, not the TSH pituitary hormone, the actual thyroid hormones that have the actual effects we need to have to support a healthy metabolism, are now normal, and here's what happened. Her symptoms were resolved within weeks. The excess weight she had gained inexplicably fell off without her even trying. A1C still really good, 5.1, triglycerides in the 40s, HDL still in the 90s, still excellent metabolic health. Her total cholesterol has dropped 80 points. No change to her ketogenic diet or exercise. What she changed was that she's on thyroid medicine now. Again, I see this all the time in clients, all the time. So again, when I see a woman, especially a middle-aged woman, cholesterol, mid to high 200s, maybe low 300s, and she's on Synthroid, I do not think that this is a cardiovascular problem. That is a sign that her thyroid is not being adequately treated. Okay, most importantly, her TSH is suppressed into the basement, but she has no signs of hyperthyroidism. And I'm pointing this out because in medical school, the classic teaching is that if your TSH is low, you have hyperthyroidism or you are over-medicated. And thank you for nodding. You've probably been through this exact thing. When your TSH is low, the doctor assumes you're over-medicated because the only time that they know of a low TSH is hyperthyroidism. But this person had no signs or symptoms of hyperthyroidism. In fact, she felt better than she had felt in years. And I'll tell you how I know. Because those are my numbers. Those are my numbers. This is why I'm so passionate about this. This isn't some client I worked with. Well, I guess it is, but she didn't pay me, so I just I had to treat her for free. So this Antonio Bianco, MD, is a former president of the American Thyroid Association. You do not get more conventional than this. And yet, he just released a book last fall. Treatment of hypothyroidism is not as simple as we patients and physicians and patients have been told. Many more things need to be considered in addition to circulating levels of TSH. Out of the mouth of the former president of the American Thyroid Association. This is not, now, and anyone here know the humorist Dave Barry? You know how Dave Barry often says Dave Barry is not making this up? Amy Berger is not making this up. If you don't believe me, believe Dr. Bernstein. Who here is familiar with the name Richard Bernstein? Yeah. Dr. Westman calls him the Oracle. This guy knows what he's talking about. Serum TSH does not reflect T3 levels throughout the body. It is not a good marker for hypothyroidism. Serum-free T3 is the best indicator of thyroid status. The standard of care is wrong, and hypothyroidism is grossly mistreated. That is an understatement. Okay, this, I think Bronson or somebody, like, we can make the slides available because all the sources are there if you want to look at these studies. Why are we following a test which has no correlation with clinical presentation? The thyroidologists have decided that this test is the most useful for following treatment, when in fact it is unrelated to how the patient feels. The consequences of this have been horrendous. I do not understand how a doctor can have somebody sitting across from them saying, I'm losing my hair, I'm constipated, I have no libido, I can't lose weight no matter what I do, I've got this and this, I've got these 17 symptoms. Well, your TSH is normal, I guess it's not your thyroid. Are you kidding me? Are you kidding me? All right, so I mentioned earlier, you've got to get the comprehensive thyroid panel. If the TSH doesn't tell the tale, what does? We need to be looking at all of these other hormones. And most doctors only do the TSH and the T4. They'll do T4 if you're lucky. It is not always sufficient to identify thyroid problems. If those levels are normal, you don't know what's going on. But now if we dig deeper, you might, if you look at the T3, look at the reverse T3, you will identify the imbalances in these other hormones that are causing your symptoms. This is a very, very common scenario, especially with difficult weight loss on low-carb and ketogenic diets. Right. I think I've beaten this to death. We're going to, because I have more to cover. All right. I mentioned earlier that even if your values fall within the normal ranges, that means nothing. A client of mine once said, normal is a setting on a washing machine. It is not an adjective to describe human hormone levels, right? So let's look here at some examples. It might be hard to see in the back, but just look at TSH. A normal reference range, 0.5 to 5.0. That is a 10 times difference. So your TSH could be one level, her TSH over there could be 10 times higher, and you are both considered normal. Same thing, look at total T3. Total T3, we've got from 60 to 180. That's a tripling. Your free T3 could be one level, or sorry, your total T3 could be one level. My level is 3 times lower, and we're both considered normal. So when I say that the normal values are a hodgepodge, boy, that is putting it mildly, isn't it? This is, what it is a travesty. So I think we can all agree here, normal does not mean optimal. Normal is not an adjective to describe human hormone levels. And I think the example is clear enough with thyroid here, but if it wasn't, let's talk about fasting insulin. Many of you maybe had to do this on your own because your doctor was like, what? I never tested insulin, why would I do that? Anyway, the normal or reference range for fasting insulin, depending on the lab you use, sometimes it can go as high as 20 or 25, whatever, micro international units, whatever. Most of us in the keto world would agree that that's way too high. We can debate about what is optimal, but 20, too high. But that's normal. Normal does not mean optimal. Normal does not mean you will feel your best. There is no normal for thyroid. One person might feel perfectly great with a T3 of a certain level, and some other person might need to be 3 times as high to feel their best. There is no normal. There's only how you feel. I beat myself to it. How you feel is more important than the lab numbers. We get so hung up, and thanks to Jocelyn for such a great talk, we get so hung up on these numbers. My number, what is this? My ApoB, my particle this, particle that. How do you actually feel? Mark Sisson once said the greatest thing. He said, because he was talking about, the step trackers and all these devices and gadgets, and he said, the day I need an app to tell me whether I'm happy, take me out and shoot me. So how do you actually feel? When somebody sends me their thyroid labs to look at, I'm like, first tell me, I don't even want to look at these. Talk to me about you first, and then I'll see what makes sense in these numbers. All right. Like I said earlier, T3 does its job inside the cells, not in the bloodstream. So whatever's hanging out in the blood has nothing to do with how you actually feel. That blood measurement, that level, is the second runner-up because we can't measure the number one thing we're interested in. So if your results are normal, like you fall within the normal range, consider the shortcomings of that range. If the range is 8 miles wide and you're at the very, very bottom of it, maybe you would feel much better if you were at the midpoint or higher. But you'd still be considered normal anywhere along that spectrum. So if the blood levels don't tell us, or the blood levels don't tell us how much is getting in the cell, what does tell us? The symptoms, how you feel. If you feel great and you don't have any signs or symptoms of low thyroid, then however much is getting in your cells is enough. We don't have to measure it. So this is a consensus statement, again, from some of the most conservative, conventional organizations you can imagine. Serum thyroid hormone levels are only a surrogate marker and may not reflect what is taking place at the cellular level. What tells us what's taking place at the cellular level is how you feel. And I don't know when the last time was that your doctor asked you that, or they come in and they look at your chart and they never actually ask you, how do you feel on a daily basis? All right, I think I might have to skip. Well, no. Let's talk about meds. The best meds are meat, eggs, dairy, and seafood. But sometimes we need thyroid meds, and I'm very grateful they exist. Let's not poo-poo all of modern, pharmaceutical intervention, especially when it can genuinely help us. So the most commonly prescribed thyroid medicine is called levothyroxine. The most common brand name is Synthroid, and I know there's several people in this room who are taking Synthroid. Some people do perfectly well on Synthroid. Some people take it and they feel great and it's no problem. A lot of people don't. We'll get to that in a minute. This levothyroxine is T4 only, right? But what did I say? T4 has to be converted into T3. And not everybody's body does that well for many reasons that sometimes we don't know why. But sometimes you just don't make that conversion well. So just keep in mind that that's a T4 only. There is a T3 only. It's called liothyronine. The most common brand name in the US is Cytomel. You almost have to murder somebody to get a prescription for Cytomel these days. Doctors are very, very skittish about it for reasons that I don't remember if I get into here. But so this provides T3. There is also natural desiccated thyroid. If anyone's taken or heard of Armour, that is natural desiccated thyroid. That is actual animal thyroid glands that are dried and dehydrated and powdered and put into capsules. So Armour, anyone, if you've ever bought Armour sausage or Armour hot dogs, the pig thyroid glands, they harvest them from the, it's a different company that owns it now, but that's how it started. That's why it's called Armour Thyroid. It was from the Armour, pork company. All right, so this natural desiccated thyroid gives you T4 and T3 because it's whatever is in that gland and some other accessory compounds. Okay. There is no right or wrong with thyroid medicine. There's only what works best for you. Natural is not better than synthetic. Synthetic is not worse. Different things work for different people. Like I said, some people do well with Synthroid. Some people do better with the natural. It can take a lot of experimenting. There's no right or wrong. Here is the big problem with Synthroid. Like I said, it's T4 only. Some people take it and they don't feel any better. The other problem we have is that if you take T4, you run the risk of having it be converted into that reverse T3, which is the last thing we want. When your T3 is already low, you already have low thyroid, the last thing you want is more of that reverse T3 blocking the real T3 from getting in. But if your actual T3 is still low, you won't know if you don't measure. So these are the people who are I'm taking thyroid medicine, but they still have all the same signs and symptoms they had before they started the medicine. They still feel terrible. Some people absolutely positively must take T3. And this, when you take thyroid medicine, whether T4 or T3, your TSH will plummet. That example of me, my TSH was unmeasurable. I was not hyperthyroid. This is a normal phenomenon. So if you take T4 medicine and your TSH goes through the floor and your doctor says, oh, we have to reduce your thyroid medicine, you're over-medicated, even though you still feel like garbage. How could they possibly say you're over-medicated when you still have all your same signs and symptoms of being low? So this is from Janie Bowthorpe. Some of you might know her from Stop the Thyroid Madness. T4 medication treatment does the job to the same degree that an elevator, which only rises to the 5th floor of a 50-story building, does the job. But again, I don't want to badmouth Synthroids. It works for some people, but there are several thousand people for whom it doesn't. So, like I said, suppressed TSH, this is a huge thing in the medical world. Every time a doctor sees your TSH in the floor, he or she is going to say, you're over-medicated, we need to reduce the dose. Are you hyperthyroid or over-medicated in the complete absence of symptoms of hyperthyroidism? Some people feel best on doses that are going to make that TSH plummet. The reason most doctors are really, really scared about giving you T3, especially if it makes your TSH really low, is because there are concerns about problems with like AFib, especially cardiovascular function, and osteoporosis, bone problems. Except this is a gross misunderstanding of the science and of the physiology involved. It is almost unwarranted fears, and even if those problems start to come up, it's easy enough to reduce the dose of this medicine. We are so skittish and so conservative with prescribing this medicine because of these mythical things that might rarely happen and almost exclusively happen in people with pre-existing risk factors. And yet, doctors have no problem filling scripts for all kinds of drugs that come with extremely terrible side effects that they're handing out like candy. And so rather than the risks, what are the risks of over-medicating somebody? What about the risks of under-treating? What about the risk of continuing to leave a patient depressed, constipated, no libido, brain fog, fatigue, just horrible? These things might not sound bad. When you put them all together and they're severe, this ruins your quality of life. Absolutely ruins it. Ask me how I know. So what about the risks of under-medicating somebody? Our findings emphasize the need for laboratories to make their users aware. The reference ranges for thyroxine, which is T4, and TSH in patients receiving hormone replacement are considerably different from the conventional ranges. So maybe we need a new normal. If you're on thyroid medicine, here's your normal range versus if you're not. Dr. Westman, my co-author on End Your Carb Confusion, talks about how maybe we need a keto normal for some of these not thyroid, but where certain blood parameters are different in people eating a ketogenic diet. So maybe we need keto normal for cholesterol and triglycerides and BUN and some of this stuff. Maybe we need thyroid medicine normal for people that are taking thyroid medicine. All right, this is killer, if I do say so myself. Somebody guess, what is, data from 2020, what was the #1 most prescribed drug in the US? Atorvastatin. #1, 26 million patients, and we got 13 and 17 most prescribed 2 other statins. Okay, so we got millions upon millions of statins being prescribed. We've got millions upon millions of antidepressants being prescribed. In 2019, 7 different kinds of antidepressants were in the top 50 most prescribed drugs. There are 4 of them. Okay. Millions and millions of people on statins, millions and millions of people on antidepressants. What were some signs and symptoms of low thyroid? And guess with me, what is the #2 most prescribed drug in the US? You ready? Brace yourself. It's levothyroxine. So how many millions upon millions of people are taking statins and taking antidepressants when what they actually need is better thyroid medicine? They need T3 because the levothyroxine is not working. It is not getting the job done. If it was working, they wouldn't have super high cholesterol and they wouldn't still be depressed. The first thing in me to clear up when I got on the correct dose and type of thyroid medicine was my depression. It's the first thing I noticed was that my mood, I think I actually want to be alive today. What did that like? It was, okay. Normal TSH values may not rule out patients that are hypothyroid. It's possible that a large number of hypothyroid patients are missed using the TSH as a screening tool, which is a problem for the patient who remains hypothyroid and to the healthcare system as a whole. It's a huge, well, of course it's a problem for the patient. You're still depressed and cold and you have brain fog and you can't function and you're constipated and all that great stuff. It is a massive problem for the healthcare system as a whole because instead of taking the one medication that would fix all of this, instead, they're on the statin, and they're on 3 antidepressants, and they're on a stool softener, and they're on Rogaine for the hair loss. And now they've got multiple appointments, and they're on drugs to treat the side effects of those drugs. This is madness. Okay, I'm going to blow through this. How much time do I have left? What? 5 minutes? Okay, I got to blow through this fast then. Real quick, you can get these slides if you want. Up to 40% of people with hypothyroidism have significant depression. Up to 40% of people with major depression don't have resolution of their symptoms. 52% of patients with refractory, meaning difficult to treat depression, showed evidence of hypothyroidism. I'm going to blow, sorry, I got to blow through this. They, in trials of thyroid medicine for depression, the range of doses of T3 can go from 13 to 188 micrograms. That is a very high dose of T3, 188 micrograms, but that's what some of these people needed to feel their best. An endocrinologist would shudder. They would be shaking in terror at the thought of giving somebody over 100, let alone 180 micrograms of T3. All right. I'm sorry, I have to blow through this because I'm running out of time. Let's look real quick at sorry. I want to make sure that I cover everything. I'm sorry. This is poor planning. Okay, well, all right. Just the main thing to keep in mind, I said, the normal, it's not enough to be normal. Where you fall within that range makes a huge difference. You could be at the very low end of normal versus the high end of normal, and we're talking about only a small difference. A small difference in these numbers can have a huge difference to how you feel, including how easy or difficult it is to lose weight, whether or not you're on a low-carb or ketogenic diet. So let's look at, in the middle section, post-obese women. Women who were larger at one point and lost weight, dieted down to a certain size. When we compare them to women who have always been smaller, who never had to lose weight, the women who were post-obese, the women who are maintaining a lower body weight than they were, their resting metabolic rate was 8% lower. 8% does not sound like much, but the researchers, through whatever math they did, determined that that could be responsible for a weight gain of as much as 22 pounds. An average size women, 5'2", 5'5", 5'6", 22 pounds makes a huge difference. And not only that, but look at the free T3 in the women who were smaller than they were. They had dieted down. Their free T3 ranged from 1.9 to 3.0. In the controls, meaning the women who had always been slimmer, never were bigger in the past, their free T3 was from 2.9 to 3.9. So we've got the women who had lost weight, their highest T3 is almost the same as the lowest T3 in the women who had never had to lose weight. This is evidence for us of the yo-yo diet cycle and why it is harder to lose weight every time, and it is harder as you get older when you've been on that roller coaster for 20, 40, 50 years. Because each time your metabolic rate is a little bit slower, a little bit slower. It's not in your head. It is actually more difficult, and this is part of why. So to talk about a very, very small difference in that metabolic rate and what a huge difference it makes to your body size and just how you feel, this is from that former president of the Thyroid Association again. A reduction, he had women who were taking T4, and their TSH was normal, so their thyroid is normal, right? Because it restored TSH. The reduction in the metabolic rate in the T4 treated patients may seem small. With time, though, it is bound to have consequences. Imagine a car going at 50 miles an hour and another car at a slightly slower speed, 48 miles an hour. This might seem a small difference, but at the end of 24 hours, the two cars will be almost 50 miles apart. Thus, maintaining a 4 to 6% lower metabolic rate for months or years will have a major impact on the overall metabolism. Okay, let's talk about low-carb diets and thyroid. Oh, keto's bad for your thyroid. Women shouldn't do keto because your thyroid, the thyroid. So, who's heard that? Like the first time you've ever heard that? Yeah. So, some people adopt a low-carb or keto diet, and their thyroid gets better. They can actually reduce medication and eventually stop taking it. That does happen. So it is not true that if you start thyroid medicine, you will need to take it for the rest of your life, except if you have had your thyroid gland removed or irradiated. Yes, of course, you will need hormone replacement. Any of you in that situation who are taking T4 only, if you still feel like garbage, come see me later. You probably need some T3. Because that's just the standard of care. When they take your thyroid gland out, they put you on Synthroid because they assume it's enough. So how do low-carb diets affect thyroid status? Your hormone levels might change, especially your T3. What a shock. You radically change your diet. You completely eliminate most of the sugar and starch. You just change your whole diet and lifestyle, and your hormone levels might change. I'm shocked. This is my surprised face. So but just because T3 changes doesn't automatically mean there's a problem. If your T3 decreases, but you feel fine and you have no symptoms of hypothyroidism, then it's not a problem. You do not have hypothyroidism if you feel great. So you might have increased sensitivity to T3, where if your body is in a healthier state, you require less T3 to get the same metabolic effect. So of course the level goes down. You don't need as much. This is exactly what we see with insulin on a low-carb diet, right? It restores insulin sensitivity. You need less insulin to do the same job. It could be the same with T3. Anyone here heard of Stephen Phinney? Yeah, like who's that, right? For anyone who doesn't know, he's one of the real OGs. He's just one of the world's most renowned researchers in this field. And he said, how many published studies from well-designed prospective human trials have shown that impaired thyroid function occurs on a ketogenic diet? The answer to this question is quick and simple: none. So, to sum up, no, I do want to say that I do see women especially running into thyroid problems on keto, but it's not because of keto. And I'm sure that all the personal trainers in here will back me up on this. It's not because of keto per se. It's because these women are starving themselves and over-exercising. Of course your thyroid slows down. Of course your metabolic rate slows down. Your body is doing you a favor. It's trying to protect you from burning out. It's not going to let you keep going at that pace. You give these women more food and all of a sudden they feel better. You tell them to stop exercising 97 hours a week and all of a sudden they feel a little better. So you can run into thyroid problems, but that can happen on any way of eating. It's not unique to keto. All right, TSH, not always the best indicator of thyroid status. If you know that you feel terrible and your doctor says it's not your thyroid, either get a new doctor or get the testing done on your own. The normal ranges might leave you undiagnosed and undertreated and still suffering. Levothyroxine or Synthroid is not effective for everybody. Some people require really high doses of T3. Some people can take a tiny baby dose, 5 micrograms, and they feel like a new person. Some people need 10 times that much. There's no right or wrong. Advocate for yourself. You have to fight for yourself. I'm writing a thyroid book right now. My co-author, Carol Rosemont, and her research partner said, we will never argue for the dominance of a lab test when signs and symptoms are present. And everybody asks me, you know, my doctor will only order TSH. They said my thyroid's normal, this, that. Okay, either find a new doctor or be very diplomatic and very kind, and you just have to present it like, you know, doc, I understand that my TSH is normal, but why do I still have these 14 symptoms? Why do I still feel so terrible? If you are convinced it's not my thyroid, what else do you think it is? Help me feel better. Help me find an answer here. Or could we possibly dig into some of these other thyroid tests just to see? Because otherwise, we together have no answer, no explanation for why I feel so terrible. You know, you have to fight for yourself, but you have to be diplomatic about it. But that's, I just recently told someone to approach it that way. Say, you know, I really have been feeling awful for a long time, and I just would love some help trying to figure out what this is. And I think that's it for me. All right. Thank you.